Ronald Acuna Jr. of the Atlanta Braves suffered a non-contact knee injury against the Pittsburgh Pirates when he attempted to steal a base yesterday. At the time of the injury, there was not a lot of speculation regarding the severity of the injury. However, it looks like, as of right now, sources have confirmed that he's in fact unfortunately torn his ACL and he's going to miss the remainder of the season. There is a camera angle of the injury which shows what looks like his left knee go into something known as a dynamic knee valgus, and that's something I want to focus on with today's video as to why that is so risky for somebody's knee. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy, and with my channel I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I'll also go over the relevant anatomy for that injury and talk about what that person should expect when attending rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have gone through the ACL rehabilitation process, go ahead and comment in the comment section below. We can see right here in the injury replay that as Acuna Jr. is on second base, he's going to take off like he's trying to steal third and then maybe at the last second pull up like he's going to come back to second. As he does this, he's going to plant with his left foot and we just see that left knee cave in and buckle awkwardly. Here I have a model of the knee joint, and so the knee is formed by that femur, also known as the thigh bone, is going to come on down and form the top portion of the knee here. At the bottom part, we have the tibia, often called the shin bone, is going to come up and form the bottom portion. And then laterally or towards the outside portion of the lower leg here, we have the fibula bone. There are four main ligaments that contribute to overall stability at the knee joint. The first one and most applicable ligament for this video is that anterior cruciate ligament, also known as the ACL, is located right in through here. As we flip the model medially or towards the inside portion, we have the medial collateral ligament, also known as the MCL. On the outside or lateral portion, we have the lateral collateral ligament, also known as the LCL. And finally, on the back here, we have the posterior cruciate ligament, also known as the PCL. All four of these together are going to make the knee joint extremely stable when they are intact. As we look at these two structures in through here, these are the medial and lateral meniscus. You can think of these essentially as pieces of fiber cartilage that are going to act as shock absorbers between the femur and the tibia bones. Now let's talk about the function of the ACL. Now the ACL has several different important jobs at the knee. The first one is that it's going to prevent any sort of anterior translation or frontal slipping of that tibia bone. And this has to do with its attachment points. So anytime we see somebody's knee go through a motion where they're getting a lot of posterior to anterior force like this is going to put them at risk for an ACL tear because it is essentially checking the job that the ACL has at the knee. One other important motion that it essentially provides stability in is a rotational stability at the knee joint. So anytime somebody is going to have a rotational force go through the knee where they are planting and they're trying to cut or any sort of violent stopping like we saw in the injury here, the ACL is going to act to provide that rotational stability. And sometimes if the force is great enough, it's going to result in that ACL tear, which is what we saw in this video, unfortunately. This rotational position that we see at the knee in this position where somebody is going to essentially externally rotate their foot and internally rotate their thigh, this is known as that dynamic knee valgus position. It can be very risky for the knee because as you see in the model here, as I externally rotate the lower leg and internally rotate that femur bone, that's going to provide a lot of strain and stability going through that ACL, which is what we saw in the video. So we saw that as he was running, he plants with that left foot, he internally rotates with that femur bone, and as he does this, that's when that knee essentially caves inwards. In injuries like this, some other structures that could potentially be at risk are the MCL because as you see here too, as I twist the knee like this is going to provide strain going along that medial collateral ligament. And then also, it's going to provide a little bit of risky position for that medial meniscus. At the time of this video, there's not been any word on whether or not the MCL or the meniscus has been involved, but I just wanted to let everybody know that yeah, it is possible that other structures can be implicated in this type of position. And on the field or in the clinic test, we do to determine essentially if we think somebody has suffered an ACL tear is something known as a Lockman's test. And in this positioning, what we're going to do is we're going to slightly bend the person's knee and we're going to pull on that tibia bone coming forward like this. And we're doing this because once again, a major function of the ACL is to prevent that motion. So what we're doing, we're pulling on that tibia, we're feeling for any laxity, Then we're comparing it to the non-injured knee, and we're seeing if it feels dramatically different. If it does, then we essentially believe that the person has suffered an injury to the ACL, and they're going to require the gold standard to diagnose it, which of course is the MRI. MRI, of course, will give us a grade of the ACL injury. There are grades 1, 2, and 3 in a grade 1 ACL injury. This is where you're getting stretching of the ACL. In a grade 2, this is where you're going to get partial tearing. And finally, in a grade 3, this is where you're going to be getting that full rupture. Usually in grades 1, because there is just some stretching of the ACL, this is not going to compromise the stability at the knee joint. But in grades 2 and 3, because in grade 2 you have partial tearing, and of course in grade 3 it's a full rupture, this is greatly going to compromise the stability at the knee. Since they are saying that Acuna Jr. has suffered a torn ACL and he's projected to miss the remainder of the season, it sounds like he has suffered a full grade 3, which is going to be requiring essentially surgical intervention to do something known as an ACL reconstruction to essentially build him a brand new ACL. There are 2 types of grafts that can be used in this particular type of surgery. There's one known as an allograft, which is going to come from a donor, usually a cadaver, and then there's something known as an autograft, and this is going to come from the person's body. When it comes from the person, it can come from a number of locations, first being the hamstring tendon, it can also come from the patellar tendon, and finally it can come from the quad tendon. After surgery, this is when the person can of course start attending rehab and they can start the recovery process. Now, it does depend on the type of graft as to how fast we can progress that person in terms of things like weight bearing status and certain strengthening exercises. But generally for the first couple weeks, they're going to be in a big drop lock brace is what we call it. And that brace essentially spans from the thigh going all the way down to the ankle. And this is because we want to stabilize the knee as much as possible to essentially protect that brand new graft. Then from this phase on to about the 6-week mark, this is when we want to get that person within fairly normal range of motion of that knee. So we can start to progress them pretty aggressively depending on how they're presenting. And we can start to include certain strengthening exercises as long as it's not going against the type of graft that the person has received. Then as the person is starting to improve with therapy and they're having successful visits with the surgeon, we can start to progress them into a little bit more of advanced exercises. And the whole process is going to take anywhere from at least 6 to about 9 months. So this is a very long recovery process. So it is very, very expected that Acuna Jr. is going to miss the remainder of the year as they have projected. And fortunately, everything is going to go well in terms of the actual recovery process, but sometimes this does linger into the next season. So if there's any updates regarding his case down the line, I'll be sure to make a video or update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So we wish Ronald Acuna Jr. the best of luck moving forward with this ACL tear. I know that he did have a torn ACL in his right knee, so this is a devastating one to see. Wish him the best of luck moving forward. Hopefully he's going to make a full recovery. Thank you so much for tuning into my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.